All right, good afternoon, everyone, and welcome to the October State Advisory Council meeting. I'm Dr. Morgan Crossman, and I'm the Executive Director for Building Bright Futures. Today's State Advisory Council meeting is a packed agenda, no surprise. We will be calling for a vote of the 2021-2022 policy recommendations on behalf of the State Advisory Council. We are also going to be talking about our Early Childhood Action Plan, so the VECAP. Specifically goal 4, which is an early childhood system that's integrated, well-resourced, and data informed in terms of that goal 4. And we'll be talking about the work that we're going to take on in this next year and thinking about what it means to be a well-resourced system. And then we'll end today's session with a really exciting spotlight of data for this year's State of Vermont's Young Children and Families report. It's really going to be focused on an examination of the extent to which the workforce crisis is impacting children and families across sectors. So we have some exciting guests here to talk about that data, why it matters, and what can be done. I'm going to start us off with a mindful moment, which is a typical start to Building Bright Futures meetings. So this has become tradition over the last year and a half through the pandemic. And today we are going to use that mindful moment to remember a dear friend and colleague, Mariah McGill. And I'm going to just let folks know that this is a very emotional day for our team. Mariah McGill was tragically taken far too soon last year on October 26th. She was a member of the Building Bright Futures team as a regional coordinator for Building Bright Futures. And before that position was really well established in the early childhood arena, working as the director for the Early Childhood Leadership Institute at the Snelling Center for Government. This is especially an important day for us to be able to remember Mariah. For those of you who don't know, at Building Bright Futures, we really intentionally create space to get to know our team members. And a year ago, we had one of those personal conversations where we were getting together to know more about our team. And in that conversation, Mariah and I identified that we had a shared love for the holidays and baking with our daughters. So every time that I bake with my daughter, Amelie, I'm thinking about Mariah. And so we just wanted to say to Mariah and her family, we love you, we miss you, and we are so proud of the work that we are doing now in many ways because of you. And I'm going to turn it over to Beth.
Thank you. So in honor of Mariah, I'm just going to ask for us to take a moment of silence, please. Mariah was passionate to improve the lives of children and families in Vermont. This was clear to those of us who knew her as she would parented in her volunteer roles, in her professional work. It emanated from her. We think that she would be excited about the bold recommendations and opportunities that we are all living into here at this meeting and in our work. So holding her spirit as we continue today. Thank you. So I'm going to hand this over to Chloe to move us into our business.
Thanks, Beth, and thanks for that thoughtfulness. Good afternoon, everybody. I am Chloe Leary. I'm the Executive Director of the Winston Prouty Center in Brattleboro. I'm the co-chair of the State Advisory Council and of our local Southeastern Vermont Council. And I'm happy to see everybody today. Welcome to this very important discussion. Thanks for all your work and commitment to kids and families in Vermont and for taking time to do this important work. This is my favorite part, to do the roll call to see who's here on the State Advisory Council, because I feel like I get to say hi to everybody. So I'm going to go ahead and do the roll call. And for those of you who are not State Advisory Council members, please introduce yourselves in the chat. Say your name, your affiliation, if you're an organization or parent, if you're connected to a local council or a early childhood action plan committee, so anything like that. So please feel free to jump into the chat and let us know who is here. That would be great. And I will do the roll call and I'll try to see everybody. And when I say your name, if you just unmute, say hi and say your affiliation, that would be great. So Cheryl, are you with us?
I sure am. This is Cheryl Wilcox of the Department of Mental Health. I'm also the public co-chair of the State Advisory Council.
Thank you. And then Renee Kelly, I think I saw your name.
Yes, good afternoon, everyone. Renee Kelly. I serve as the director of the Vermont Head Start Collaboration Office.
And Miranda Gray.
Good afternoon, everyone. Miranda Gray. I'm the interim deputy commissioner for the Child Development Division.
Thank you. Ken Jones, are you with us? Okay. And
Just
Kate
joined,
Rod-
yeah.
Oh, he did?
Yeah.
Okay.
Yeah, this is Ken Jones, economic research at the Agency of Commerce and Community Development.
Thanks, Ken. Kate Rogers.
Kate is in another meeting, had another obligation. So I'm Wendy Scott. I'm the Universal Pre-K Coordinator for the Agency of Education, and I'm representing our early team today.
Great, thanks, Wendy. And Wendy Trafton. Okay. And Lisa Stahlberg.
Hi, everyone. I'm Elisa Stahlberg. I'm the Director of Maternal and Child Health at the Health Department.
Kendall Smith. Okay, Representative Brumstead.
Hi, I'm State Representative and a member of the House Human Services Committee. Thanks.
Allie Richards. Okay, Emily Merrill. Amy Johnson. Am I going too fast? I'm going to keep going. Hopefully they'll let us know if they jump on. Christy Swenson. Wow. Laura Diaz-Smith.
Hi, everybody. Vermont School Boards Association.
Great. And Lexi Duquette. You with us? Okay. Dr. Ashley Miller. Becca Webb.
Hi, I'm here. I'm an Act 166 coordinator and an early childhood special educator.
Eddie Gale.
Hi, Eddie Gale with the A.D. Henderson Foundation.
Mike McRae.
Mike's going to be a little bit late, Chloe.
Okay. And Paul Dragon.
Hi, everyone. Paul Dragon. I'm with the Champlain Valley Office of Economic Opportunity.
Nice to see you. Did I miss anybody on the State Advisory Council? Sometimes I go through the list too quickly. All right, great. Welcome, everybody. Really nice to see you all. I'm just going to do a reminder about our group working agreements, which we have on the screen in front of us. Just take a moment to think about them and maybe consider these two, especially today. Consider the opinions and experiences of others. It's the second bullet there. And then bring a spirit of experimentation and creativity, one of my favorites. So sort of in the middle of the bullet list there. So as we go through our work today, maybe hold those especially in front of us as a way to focus. So thank you for that. And finally, for council business, we have minutes that we need to approve from the September 27th meeting. Can I have a motion to accept the September 27th minutes?
I can make
Sorry,
that
this is
motion.
Cher.
Chloe.
Oh. Becca, I think I heard you. Did Becca made a motion to approve? Is that right?
Yes.
Okay, and then a second?
I'm
Cheryl,
happy to second.
thank you, Cheryl. Any discussion of minutes or questions? Okay. All those in favor, maybe put up your thumbs or hand or wave or say yes out loud. Try to capture all of that.
Aye.
And is anybody opposed? Okay, and any abstentions?
Ken Jones abstains.
Okay, thanks, Ken. All right. I'm going to assume we have a quorum and we have the September 27th minutes approved, and I will hand it back over to the team. And Cheryl, I think you are on.
Yes. All right, hopefully everyone can hear me. It's always I'm amazed that I'm still not the fastest clicker and back and forth with mute and screens. So we're going to look at our policy recommendations that came out of quite a significant amount of work and input. These were presented last month by Morgan for final review and feedback. So the feedback from last month was taken and an updated version was sent out. Hopefully everyone received that ahead of time to look at. So just as a reminder for folks, the State Advisory Council are the leaders who are chosen as the primary advisory body to the governor and legislature on all things related to early childhood, and annually make formal recommendations, which is one tool in how we do this as a council. So these recommendations were for anyone that was involved, a broad scope of feedback from the Vermont Early Childhood Action Planning Summit, other Building Bright Futures, network gatherings, council meetings, discussions in the different group settings that are a part of VBF, and the recommendations fall into the 5 themes that you can see. We aren't going to go through the specifics again because we know these have all been reviewed and folks have provided more feedback, and we also talked in some small groups last month about them. But we wondered if anyone had questions about any of the proposed recommendations. So I'm going to hand it to Beth, who will review how we got here.
Thanks, Cheryl. Yes, hi all. I'm Beth Trusansky. I'm the Deputy Director of BBF. And the priorities for this year, as Cheryl mentioned, we worked hard to make sure that they address a range of issues that we were hearing from those of you who are working with kids and families and at all different levels of the system. You will see that they fall into 5 categories. And so responding to Vermont's mental health crisis facing families, our workforce crisis, addressing inequities, including, they also include a need to make changes to address the workforce crisis across our state. The recommendations also call to build a well-resourced and data-informed system and to leverage the amazing opportunities that we have this year and hope to have both with the early childhood systems needs assessment and the proposed federal investment with the Build Back Better plan that we are tracking. These priorities emerged from VECAP committees and regional councils and were presented as concepts when we gathered in July at the VECAP summit. That was served as the July State Advisory Council meeting. And then recommendations were drafted and presented back to committees and those who provided input over the last 2 months. We've continued to gather input and are presenting a final draft for you to endorse today. So just want to say thank you for your engagement, because these recommendations are stronger when we are engaged and provide our input and perspective, which we all bring to the table. So a few things to note about this year's recommendations. First of all, we're calling out areas where there are barriers in a few cases that need a strategy to reach resolution. We recognize that policy recommendations sometimes are a multi-step process, and identifying common agreements, definitions is the first step towards reaching resolution and shared policy. So there are a few places where we are calling out some of those barriers and needing a strategy. In addition, some recommendations are geared toward administrative policy and practice, while others are geared toward legislators. We will work with all of you to understand what the policy recommendations are, in addition to helping to develop them. Morgan and the team are already presenting these to legislative committees, and these really can actively be used once they are endorsed. They can be used in reviewing and writing policy. They can be used in identifying priority areas to focus resources. And we look forward to being able to share and use these as a tool to make change. I will take a moment if there are any other opportunities that SAC members see to use these policy recommendations. We would love to hear your ideas. Okay. So it's a conversation that we will continue. We recognize that the process to develop both policy recommendations and move that into action is nuanced, and so when you turn to them to inform decision making, we would love to hear more. Is there anyone who has any concerns about supporting any of these recommendations that we have presented today? Any SAC members we haven't heard from yet? Well, again, we want to thank you all for the input all along the way to make sure that we are developing recommendations that align with what the state needs right now. If there is no other feedback, then I think we are in a place to take a vote to accept the slate. So I'm going to hand this back to Cheryl to do the vote.
I see that Wendy has her
Oh,
hand raised.
okay, Wendy,
I
yes.
had a question just for the group. And number one, they invest in community-based mental health supports for children and families. I was wondering if you were also going to include private program education, their teachers need help also in mental health. I didn't see that that's covered in here. We're offering supports for children and families, but could we also have those supports in for teachers also? Or was that already implied that I missed that?
Thank you, Wendy, for the suggestion. So it just as an example, you're looking at the second bullet. I would imagine that we could include teachers as one of the many people who are working with kids and families who would benefit from supports. Certainly.
Well, it says address the mental health workforce crisis in Vermont, but not, that means that we're looking for mental health counselors, psychologists. That's a crisis that but we also have this other segment for the private program teachers, their staff need to have those supports also, the mental health supports.
Thank you, Wendy.
Their reactions to children on a daily basis, they've been working throughout the pandemic, and a lot of them don't have the time or the funding to do this. And I think it's really important that we include those folks too.
I appreciate your suggestion, Wendy. I think at this point, we are really looking to accept the nearly final draft. And so I think the essence of what you're saying perhaps is captured without being able to note teachers specifically. This recommendation does reference mental health workforce, and there are places elsewhere in the recommendations where we are talking about the early childhood workforce and educators. So I wonder if we can capture that comment and see if there's a way to note perhaps in some of the other work that we're doing, if there's not opposition to accept the slate right now, recognizing that what you're saying is absolutely is true. I don't want to make too many adjustments to the slate as it is right now. Is there anyone who has suggestions about some adjustments to language right now? Or Wendy, can we capture your comments so that we can incorporate it into our future work?
I also think that some of our other SAC members have suggested that they feel like it is captured, at least in part, in the first bullet around the different settings, but that we can be a little bit more clear But I really appreciate the feedback, Wendy. And I think that it's an important thing to more clearly call out, but I hope that it is really captured in expanding the connection of mental health in primary care and education settings. And maybe, you know, when we think about training and investment, that is where it's really captured as well.
Thank you.
Great. Thank you. It's great to hear everyone's voices. Okay. Any other comments that we have not yet heard? Again, this is a multi-step process. We recognize, you know, some people have been around the table for at all steps, and others are joining us, and it's great to have your perspective and buy-in. So not hearing any others, Cheryl, I think I'm going to hand this over to call for a vote.
Okay. So I am going to read the motion's language. The Building Bright Futures State Advisory Council and its role as advisory body for Vermont's early childhood system moves to endorse the recommendations that serve to inform the ongoing work of the system to support children and families. So I am looking for a motion to endorse these policy recommendations.
So moved, Cheryl. This is Flor.
Thank you. Thank you, Flor. Can I have a second?
I can second them. It's Becca.
Thank you, Becca. All those in favor, feel free to do the thumbs up, raise hands.
Thank you. I also want to note that Kate, I think Mike has joined us. Kate Rogers also voted in writing since she was absent. So great. I'll let you can continue.
Thanks, Beth. Any opposed? Is there anyone who would like to abstain? Trying to pause enough to scan all the faces I can see. Okay. If I missed any in those last two categories, let me know. All right, so these recommendations are going to be printed in the upcoming State of Vermont's Children and shared with decision makers. I will say, Beth, you were asking how folks have used these. We had some new staff recently come on board at the Department of Mental Health, and I actually handed them last year's book because I feel like it is such an amazing way to see the scope of what happens in early childhood and the work that's done by this group and all of the councils. So it's great to have these approved. I'm going to pass this back to Morgan.
Thank you, Cheryl, and thank you all for being here. Quick moment of celebration to say this is an incredible body of work. So thank you all. To have this slate of recommendations unanimously passed by our board is incredible, and we're really excited to think about how to move this forward. You know, one of the things that comes to mind for me is that we are really taking bold steps towards our vision in the Vermont Early Childhood Action Plan. And I think what's even more important is that this body of partners that comes together through the State Advisory Council has pushed each other, right? To be thinking beyond our individual silos, beyond our unique sector and roles, to think about what it really means to support kids and families in the state of Vermont and how we're going to move this work forward in the next 5 years. So we're going to pull back up our screen share and talk more about one specific section of the Vermont Early Childhood Action Plan. And while that's happening, I strongly advise those of you, not just State Advisory Council members, but anyone on the call today, if you have not had a chance to look at the Vermont Early Childhood Action Plan, please do it. This is an incredible body of work that our State Advisory Council members and their teams are orienting themselves to. If they've been involved in the work, they're reorienting themselves to this body of work. It's important because this strategic plan is our collective vision for Vermont's early childhood system, right? So it's to realize the promise of each and every child, ensuring that the early childhood system is an integrated, continuous, comprehensive, high-quality system of services that's equitable, accessible, and will improve outcomes for each and every child in the prenatal period through age 8. And thank you, Beth, for posting the link to the VECAP. So what's really important about this plan is that it's a collective body of work that was built over a 2-year period, right? And the visual that you're seeing on the screen right now is about holding the commitment to achieving these 4 goals and thinking about how we measure progress over the course of the next 5 years. It's also a visual that represents the fact that there is consistently new data and best practices and lessons learned in our system that we need to be able to adapt to and evolve over the next 5 years. So the visual on the screen is on the left-hand side showing you the 4 goals for our early childhood system and then how it maps to the ecological model that holds the child and the family at the center of all things that we do. And I think what's really critical for folks to remember is that this is not a Building Bright Futures document. This is an early childhood system. This is a Vermont document. It's our strategic plan, and you or members of your teams or your different layers of your own network's infrastructure contributed to building this strategic plan in the past, probably now 3 years since it's been built. And it's really important, even more so now than in the past, that we are continually reverting and looking at this strategic plan to understand how we're making progress. And as we think about all the federal investment that has been coming and continues to come into the state of Vermont, how are we looking to this strategic plan? We know the goals, we know the strategies and the objectives, we know the outcomes we're trying to move towards. So now how are we using that investment to move towards these 4 goals? So again, if you have not had a chance to review this, please dive into this with your teams and your leadership. Next slide, please. So goal 4 of this strategic plan is about being integrated, well-resourced, and data-informed. And as most of you know, Building Bright Futures is charged in statute with holding this vision and strategic plan. And we have a multi-tiered infrastructure for how we support that work. So what you're seeing on the screen on the left-hand side is the 4 goals. And then you're seeing one layer of our infrastructure, which is our Vermont Early Childhood Action Plan committees. For those of you who are not already involved, there are 7 committees that support monitoring of this strategic plan. And we wanted to highlight one of those groups today because what we've realized is that we need to elevate our communication about the levels of our network, about the people who are coming together consistently to do this work. So the group that we're going to highlight today is the Early Childhood Interagency Coordinating Team. Next slide, please. So within our levels of our infrastructure on the left, you see the arrow pointing to the Early Childhood Interagency Coordinating Team. So that group sits just above, virtually, the State Advisory Council, and it is composed of all of our public partners. I now have the jets over me, so for those of you who are next in line, I apologize. But this group is all of the public members of our SAC. So we wanted to make sure that folks know who they are and what their roles are. So you heard already today from Cheryl Wilcox, who is the chair of the State Advisory Council, Wendy Trafton, Ken Jones, Miranda Gray, Kate Rogers, and Elisa Stahlberg. So these partners are coming together on a monthly basis to do some really important work around alignment and integration. And we've already had discussions about what this could look like over the course of the next couple of years as we think about who needs to be at each of the tables to really have important conversations about how to move forward our system. Next slide, please. So as we think about goal for the VECAP, there are 3 really important pieces. The first is integration. And what we've tried to do in the VECAP document is outline what it means when we say integration, right? What are we talking about? And for integration, when it comes to ECICT, we're talking about collaborative leadership. We're talking about partners coming together to coordinate, communicate, and align both the vision, but also how we're communicating that vision to partners. As we're thinking about being a well-resourced early childhood system, we're talking about all of the different expenditures that are targeting early childhood and how we support the efficient deployment of those resources. So as we're thinking about investments, right, we know that investing in child's development, education, well-being, strengthening communities, those are the critical components of setting the stage for life course outcomes, healthy development in a range of different areas, right? Mental and physical health, social emotional well-being. And that early childhood is really serving as this critical period by which we're setting the foundation for the work. So as we're thinking about being a data-informed system, I think that at this point, all of our partners know that BBF in our entire network is committed to using evidence and data to inform decision-making. And that is another component of Goal 4. In terms of ECICT's role, again, they are the group that is responsible for integrating the work and breaking down silos at all of the different levels, but really at the highest level in state government to move towards this strategic vision. And in this next year, the 3 goals you're seeing on the screen are where ECICT are prioritizing their time. So the first is around, again, facilitating information sharing and cross-sector integration, developing an inventory of spending, specifically around all the different sources of federal investment, and conducting some fiscal mapping. And I'll talk about both of those in just a minute. In terms of BBF's charge in statute, we are actually required to develop and monitor an early childhood budget that identifies all financial sources dedicated to children and their families from the prenatal period through age 8, and to monitor, align, and leverage those financial resources. It's something that we all commit to and are excited about, and every one of us around this table wants to be moving in that direction. But unfortunately, not until this year have we as an organization or network been resourced in a way that allows us to do that. So just in this past year, we received an additional increase from our legislature, and we've sought out other grants to support this component of our statute. So in collaboration with the Vermont Department of Health, Building Bright Futures was awarded a 5-year grant from HRSA. Next slide, please. And we're going to be diving in to what this work looks like in year 1, but then also over the course of the next 5 years. And the first component of this is doing a systems asset and gap analysis. So for those of you who are not as in tune with what the feds always require in systems level grants, they say start with a needs assessment, move to a strategic plan, and we have the same series of steps. We pushed back on that in this last year because what we realized is that in the state of Vermont, we did 5 or more needs assessments in 2020. We don't need another needs assessment. What we need is to look across them and figure out where the opportunities for alignment, integration, and the gaps still are, right? So that's what we proposed, is that we are going to develop that, meta-analysis across all of the data that's been collected. We will build what we are calling an early childhood map. What that form looks like is still to be determined, but right now we're building this very comprehensive list of all of the different partners and resources in the early childhood system and really defining what early childhood is in the state of Vermont. We feel like we've done that, but there's no one specific compilation or place where you can go to see all of the different partners. And once that's compiled, we'll transition that to Vermont's Early Childhood Resource Data and Policy Center. The next component of this work is the development of an early childhood budget. So for those of you who have been a part of this system far before my time, this is something that was captured, I want to say between 2013 and 2015, but it was not something that was easily maintained or able to be built upon. And we're recommitting to that work now. So in this first year, so by July 2022, we will have an early childhood budget or a baseline early childhood budget that will identify all of the different financial sources dedicated to children and families, and be using that document to figure out how we're monitoring, aligning, and leveraging our fiscal resources. So that budget will serve as a starting point for all of our decision makers, our legislators, and others to look at the current investment across our early childhood system, and then be using that information to facilitate discussions about future investments. Where are there gaps? Where are we duplicating? How can we better align our initiatives? A key component of this is not recreating the wheel, right? So we did this, collective we, 2013 to 2015. So we have a template, but we're also looking to other states who have done this really well. So we do have some models from other states who are really focused on early childhood integration, and we're going to be thinking about what that looks like in Vermont. Another piece of this idea of building a budget is inventorying not just what's happening in state level resources, but what is coming from the feds. And so we're working especially with ECICT to look across all of our different agencies, departments, and putting together that inventory or that outline for all of the federal sources dedicated to kids and families. And again, thinking about how we are prioritizing and aligning within those categories that are coming in. The final component of this work, which is really exciting, is this idea of reinvigorating the Early Childhood Investment Committee. So you saw 7 committees in one of our previous slides. Again, we have not had enough of the resources or investment to even hold that committee meeting, and now we do, and are really excited about standing that group back up, but also see it as a really critical role for ECICT to partner with that committee to really be doing this work together, because it's not solely a public or a private endeavor. So I hope what you're seeing in this kind of range of projects is that we are positioning ourselves in the state of Vermont for, being able to make concrete decisions using our strategic plan, our budgets, and our SAC recommendations. And we're using data to inform policy every step of the way. So not only, are we positioned to receive additional federal funding once we have this series of projects completed, but as other sources of grant funding. So I'm thinking specifically about things like a preschool development grant that are really specifically focused on how we continue to move forward with early childhood systems. How do we really use all of this information and data to build that sustainability over time? I also want to say thank you to our ECICT partners who are on the call today and who are consistently doing this work. It is hard, especially because we've seen so many transitions in leadership over the last year, but it's really exciting to see our partners come together at the highest level of state government to say, we care about kids and families, and here's our opportunity to do this work better. So I'm going to pause, and I'd love to invite members of our early childhood interagency coordinating team to say a couple of words about why this group is important and how you do your work.
Morgan, I'm happy to go first unless some other folks are waving their hands. So I've been part of ECICT, I think for 4 years now, which is why it just rolls off so quickly. It took me a long time to get that acronym. And as Morgan said, it's such a great opportunity to come together with other colleagues and with Building Bright Futures to really focus on early childhood. I think we all know there is such a scope of things going on that was before the pandemic. And so that just added another layer of complication. And so having this dedicated time to make sure that we are connecting and really talking about how do we make sure we are efficient. And I think, this is the group, as Morgan said, that is, it's a pretty small group. It's folks from our different departments, the agency. And so it can seem like a bit of a mystery of what it is we're doing and what are we talking about. And so it's nice to be able to highlight it here because we don't want it to be a mystery. I think for folks to know, it is the table where we sit, where we know when we come together, we're talking about young children, we're focusing on what's needed. And how we really make sure we leverage so that we aren't thinking separately. And for me, it is one of my favorite groups. My role at the Agency of Human Services is interagency, which means I'm cutting across different departments and really trying to think holistically about children and families. They don't just interact with the Department of Mental Health or with the Child Development Division or with Agency of Education. It's all of us. It's all of the folks around that table. So it's been a really great way to stay connected and to have VBF support in doing that.
Thank you, Cheryl. Anyone else from ECICT want to make a couple of comments?
I can share, Morgan, as someone that's new to this group. It's been really helpful to be able to ground myself in this work and what our other departments and agencies have been working on, and to help them provide context as we navigate a pandemic or coming out of a pandemic, as well, just to understand where have we been and what did we need to shift in the moment and where are we trying to go back to. I too value this group a lot, and being able to think about a roadmap for early childhood systems and how can we work, how can we leverage each other's strengths to be able to build an even stronger system.
Thank you, Miranda. So, one of the things that we will continue to do at our state advisory council meetings is not just, identify and highlight what's happening at VECAP committees, but also within our regional councils, because we really want to use every layer of our infrastructure to inform how we move forward with our strategic plan. And we're really excited about the work of our regional partners and our VECAP committees in bringing all of the data and information needed to inform decision-making to the SAC. And it happens in so many different ways. So we'll continue to highlight that at this table, but are also identifying other ways to highlight some of that work. So I know a bunch of you have seen the slide come up a couple of times highlighting the Regional Council Summit that's coming up later in this year. And we'll talk a little bit about that later on today. So now we're going to shift our focus and talk about one of my most exciting things. I love data, and we're talking about the state of Vermont's children. And this year, for those of you who don't hold this on your desk and keep it in your purse everywhere you go, the state of Vermont's young children and families is such an incredible document that highlights snapshots across our early childhood sector to tell us what the status of kids and families is at one point in time. It also includes our SAC recommendations, which are phenomenal this year. But one of the most important parts of this document that we've moved to is having a featured spotlight. So what do we need to highlight in this year to be able to understand what's happening for kids and families? A couple of years ago, that spotlight was on early childhood and family mental health, and the most previous year was on COVID-19 and how COVID had impacted all of our different sectors. So I'm excited to turn it over to our research and data director at Building Bright Futures to identify and talk a little bit more about the spotlight on the early childhood workforce crisis. And we're also excited to bring on a series of guests to talk about their work in this area as well.
Thank you, Morgan. In addition to holding Vermont's early childhood strategic plan and creating an early childhood budget, another of BBF's statutory mandates is to pull together a report on the state of Vermont's children each year. Hopefully, most of you are familiar with the content, which is updated each year, formerly in How Are Vermont's Young Children and Families, which gives a snapshot, again, as Morgan was saying, of many of the factors which influence the well-being of children and families. We have heard from many SAC members, regional council members, and partners across the early childhood system about the challenges contributing to and resulting from the early childhood workforce shortage. While this has been a longstanding issue, the pandemic has clearly exacerbated it to crisis levels, and it has become a top priority across the state. Because of this feedback and the far-reaching implications, the data spotlight this year for the state of Vermont's children is on Vermont's early childhood workforce. Today, we want to highlight some of the data we have pulled together so far, and to highlight some of the work that other partners in the state have done to gather and publish data related to the workforce challenges. Anna Brulette, BBS Policy and Programs Director, is going to walk us through these data. Anna?
Great, thank you so much, Dora. So before turning to a data presentation by our partners today, we want to briefly share some preliminary data we have begun to gather for this spotlight in this year's reports related to workforce challenges in Vermont. Data stewards have kindly begun to share with us some data, and we're going to focus a bit today on childcare and mental health workforces. So you can see pictured here, between December of 2018 and December of 2020, there appears to be a pretty significant decline, as many have expressed many anecdotes surrounding in the number of individuals working with children directly in regulated childcare settings. And partners have suggested that a variety of factors are likely contributing to this, including a significant decrease in the number of aides and substitutes, many staffing changes during COVID-19, both those that we can attribute to the Vermont Department of Health's guidance from June 2020 to 2021, as well as other changes, perhaps due to demographics, folks leaving the workforce due to their age or underlying health conditions in COVID-19, as well as a lag time in providers removing their staff from the BFIS system, and perhaps this is getting better over time, and thus we are seeing that delay a little bit later. And then finally, as many have been talking about, a shortage of childcare providers and staff, with fewer individuals entering or pursuing the field overall. Similarly, we're hearing from data stewards that there is a significant vacancies in the mental health field as well. We recently heard that there was a 31% turnover rate system-wide across designated mental health agencies and specialized service agencies, which is reported to be the highest it has ever been. And additionally, a 27% turnover rate specifically in mental health programs. So overall, many things to highlight here related to childcare and mental health workforces and changes we're seeing in the last couple of years. Next, I'll turn to some things related to the overall workforce. If we could change the slide, please. Thank you. So data also suggests that obviously the Vermont early childhood workforce challenges are situated in a broader context that relate to these national trends that we're seeing and folks are talking a lot about due to resignation and other persisting challenges. So in August of this year, almost 3% of the US workforce, over 4 million Americans, left or quit their jobs. And really interesting early analysis are telling us that these resignations are highest among folks between 30 and 45, as well as women overrepresenting these number of resignations. Soon, the partners that join us will really bring to light and bring more data to the story when it comes to women being overrepresented in the Great Resignation phenomenon, and we're excited to have them join us. And finally, as many have discussed, in general, Vermont's labor force is really continuing to decline. Over 28 fewer thousand people in the Vermont labor force are in the Vermont labor force now than 2 years ago. And to give us context, from August 2020 to August 2021, Vermont's labor force declined by 1.5%, while Massachusetts labor force increased by 2.6%. So just a regional data point there to kind of contrast that these issues perhaps are even more exacerbated here in Vermont. So now I'm really excited to introduce to you all partners that will be joining us for a little spotlight presentation on Vermont's labor force and women. So I'd like to introduce to you Al Johnson-Kurtz, who serves as the communications director at Change the Story, and Kelly Campbell, who is a co-chair of Vermont Commission on Women. Al and Kelly have generously agreed to join us today to highlight what we know about women in the workforce, existing data, and ongoing efforts to learn more about these important issues. So thank you so much, Al and Kelly. I'll turn it over to you.
Hello, thank you for having us. Thrilled to be here today. And Kelly?
Yes, I'm here. Thank you as well.
Good to see you all. So as you may have seen the slide that just had the logos of Change the Story, the Vermont Commission on Women, Vermont Works for Women, and the Vermont Women's Fund. These are the partner organizations that make up the Change the Story initiative. And we're thrilled to have Kelly here from the Commission on Women representing them as well. So jumping right into the data that we were asked to share today. As you may know, Change the Story has produced 5 reports about the economic status of women in Vermont over the course of the initiative over the last 6 years. And those include reports on women's work and wages, small business ownership, and leadership. And Kelly's going to talk more about the future of that data analysis towards the end of our presentation, but wanted to share that up front. So I'll go over the highlights from our most recent report and that came out in December of 2019. And then we also have some updated data that just came out a few weeks ago to share some of the impacts of COVID-19 as well. So what does the data tell us about the economic status of Vermont women? Next slide, please. So women in Vermont are economically vulnerable compared to men. 65% of Vermont women participate in the labor force, and that's a rate that's 8 points higher than the national average, so highly significant. And 80% of those women are employed full-time, and yet nearly 4 out of 10 women who work full-time do not earn enough to meet their basic needs. Next slide, please. Motherhood also significantly impacts women's likelihood to live in poverty compared to fatherhood. And so this slide has a lot of information here, but it does show that while family status contributes to women's economic vulnerability, 11.4% of women who are single without dependent minors live in poverty. And that's a rate that's nearly 4 times higher than the poverty rate for single men without dependent children. So big gender differences here. For single men and women with minor children in the household, the poverty rates are even more strikingly different. Nearly 37% for women, but just 16% for men. The children are under 5, that rate shoots up to 47% for women. And basically all of this data is showing that women are a disproportionate share of Vermonters living in poverty across the board. Next slide, please. Racism also exacerbates the gender wealth gap, and poverty rates for women of color are significantly higher. White women have a poverty rate of 12%, and the poverty rate for Black women is more than twice that, and as high as 27%. And as Vermonters, we like to think that our state statistics are better than the national average, but what you're seeing here is that the poverty rates of Black and Asian women in Vermont are actually higher than the national average. And that's important to note here as we look towards solutions. Next slide, please. As this chart shows, women living with disabilities are more than twice as likely as women without disabilities to live in poverty. And the poverty rates for women of color and women with disabilities are higher than aggregate census numbers. So you see that. And also women with disabilities are more likely than men with disabilities to live in poverty. Next slide, please. So now we're going to look at the wage gap, and the wage gap in Vermont stands at 16%. And it's hovered between 14 and 16% since 2007. For women who work full time, that means they earn 84 cents to every dollar earned by the average man. That's averages in both cases, and that's $8,000 less per year. This wage gap persists across every county in Vermont, every age group, every education level, and is more pronounced for women of color and women with living with disabilities in Vermont. So we'll get into why. There are 2 primary reasons. A portion of the wage gap can be attributed to deliberate or unconscious gender bias or discrimination, 40%. And then 60% of the wage gap can be attributed to where women work and time in and out of the labor force. And that 60% is where we'll be focusing today. But I do briefly want to touch on the 40%. So next slide, please. Here's that 40% bias, discrimination, gender norms, conscious or unconscious attitudes, expectations, etc. Next slide, please. So one of the kind of interesting things that we put into that 2019 report was that the role of gender bias and gender norms were reflected in a study that focused on 10,000 families and showed that on average, boys earned twice as much as girls for doing weekly chores, $13.80 versus $6.71. And so it starts very young. And then they also found that within a year of graduation, wages earned by men and women who had the same major, worked the same hours, were the same age, worked in the same occupation, in the same region and sector, they had the same GPA and went to similarly selected colleges. Within a year after graduation, they were 7% lower for women. So it starts early, it continues throughout our lives and compounds as it goes. Next slide, please. So we do want to focus mostly on the 60% that contributes to the wage gap. So let's talk about it. Where men and women work plays a significant role, and then also, again, time spent in and out of the labor force. And as Anna said earlier, with COVID, we're seeing an exacerbation of time out of the workforce as women are taking on more care responsibility. We'll speak to that with some data in a few minutes, but this impacts women throughout their lives. And as women start to take off time, that adds up. So next slide, please. Looking at where women work, we see that women are a disproportionate share of minimum wage workers, making up 53% of those who earn less than $11 an hour. So that's already, has some negative impacts there. Next slide, please. We're going to look specifically at the kinds of occupations that we're talking about here. And so occupational segregation, you may know, is just a way to say which jobs people are concentrated in. So 43% of women who work full-time in Vermont are in jobs that have been and continue to be majority female. And nationally, women are a majority of the workforce in 7 of the 10 lowest paid occupations. That includes child care workers, personal care aides, food preparation, et cetera here. These jobs, which are foundational to any economy, are most often the lowest paying jobs. And that's because women's work is structurally undervalued. Next slide. Well, we also see that women are a significant minority in 8 of the 10 highest paying professions. And it's important to note that the care work in the previous slide enables these sectors on this slide, the highest paying sectors, as and all of you, I'm sure, are well aware here in this room. Next slide, please. So why do we see that women on average are spending less time in the labor force? One piece, and this was in our 2019 report, unequal family care responsibility. Women are 4 times more likely than men to cite family and/or personal obligations as reasons for working part-time. And with the Great Resignation, that may be a piece of it. Women are 7 times more likely than men to cite childcare problems as a reason to work part-time. Those are both from the Bureau of Labor Statistics. And so we can expect, this is pre-COVID, we can expect with COVID that, that these numbers are potentially being exacerbated. And then second, and Kelly's going to speak more to the survey, the impact of COVID-19 on Vermont household survey that changed the story in the Commission on Women, helped to collect responses for. We got over 500 responses from around the state in partnership with a research team from UMass Amherst to try to look at the impacts of COVID. And we saw that there were unequal expectations in the home, particularly for heterosexual couples. So women in relationships with men reported doing more household labor than their partners, including cleaning, laundry, managing children's schedules, supervising remote learning, etc. But women in relationships with women reported sharing household labor more evenly. Next slide, please. So just looking at the overall impact of this, let's add it up. The cumulative impact is showing that in Vermont, women's Social Security benefits are 40% lower than those of men. So everything we've talked about adds up to women being significantly more vulnerable as elders. And a full 44% of Vermont elderly women do not have enough income to pay basic living expenses, regardless of whether they rent or own their own home. So significant impacts. Next slide, please. But the flip side of this is that we have a huge opportunity. So if women and men of comparable ages, education levels, backgrounds, and hours worked were paid equally, the poverty rate of children with working mothers would fall 75.6%, the largest drop in the nation, and we would be adding 1.2 billion to Vermont's economy. This is not chump change. We have a massive amount to gain from taking action on this issue. It's ensuring that women can participate in the workforce is everybody's issue. It affects families, communities, and the very economic future of our state. And leaving on a high note, next slide, please. We need to speed up the pace of change. You may have seen the equal pay jerseys that came out in October 2019 and just had a resurgence this October with the Burlington High School girls varsity soccer teams. And so for these young women and for every Vermont family, we need to agree that we have work to do, challenge the logic and fairness of an economy that's reliant on a growing number of jobs like cashiers, personal care assistants, wait staff, and especially childcare workers, but it's comfortable paying those workers, the majority of whom are women, less than a livable wage, and invest in solutions like those that have been shared by the Building Bright Futures team. So I will pass it over to Kelly from the Vermont Commission on Women. Thank you all. Feel free to send me a chat if you have any questions.
Al, thank you. I've seen that slide deck many times, but it is always astonishing, and really to sit with that data and to understand what it means for Vermonters and those beyond our state borders. I am just putting in the chat a link to many of the publications I'm going to quickly reference today. We don't have a ton of time. I could dive into each of these with a lot of depth, but my goal here in the next few slides is to highlight a few of our research documents and publications that I think would be relevant for your conversation today. And I do want to thank our friends and partners at Building Bright Futures for having us. As shared, I'm co-chair of the Vermont Commission on Women, and last year, for the past few years, have chaired our Education and Human Development Committee. And so I've been lucky enough to work with some of the friends across Let's Grow Kids and BBF and others. This slide, really the point here with this slide, from my perspective, is as we think about our commission work, we really look at kind of the concept of childcare through two lenses. We are obviously very concerned about the women that are actually providing care and doing the work. And if you do reference our COVID-19 dashboard, COVID-19 crisis and Vermont Women dashboard on the site, that was a dashboard that the commission kept updated through COVID, and we seek to keep it updated. And you'll quickly see through that some of the most essential workers through COVID, our healthcare workers, our nurses, and our personal care workers, which is the point I draw your attention to up here in the left-hand corner, are prominently women. They were the backbone of COVID for us and our communities. And I think we are deeply concerned about the well-being of those that are providing the care, just as much as we are concerned about those that need the care. And in many situations, we have people who need care and provide care, right? It's a very, very intersectional topic. But I know through a recent conversation with BBF, it's really important to point that childcare continues to come up as a top intersectional issue for us as we look at the well-being of Vermont's women and girls across our state. It is a challenge, and it is intersectional, and it's very, very important. The three links below, the COVID-19 parenthood, women, and childcare documents, highlight a lot of data, some that Al highlighted today, that really speak to some of the data pre-COVID and post-COVID, hopefully one day post-COVID, and I would draw your attention to as well if you have a moment to scan them. And before I transition off this slide, as the commission looks at data, I think it's also really important to note that while quantitative data is really important, as you could see from some of Al's slides, qualitative is just as important. And we've really tried to pull out stories from members of our community across the state. And this is just an example of a quote from actually a childcare worker that was shared with us through the commission. And I think when you really sit with these words and hear these lived realities, it's just a really important point to capture as we do this work, that these are lives. I know this group knows it. And it's really important that we capture some of those lived realities and pull them out for others to read. Next slide, please. Two other things I want to draw your attention to. The first is a recent effort. You might have seen the effort on social media. It was a campaign between Let's Grow Kids, Vermont Commission on Women, Vermont Women's Fund, Vermont Works for Women, and Change the Story. And it's the Make Work Work for Us campaign. It's also linked on our website, but relevant to today's conversation, it definitely looks at the data. Since the pandemic began, 80% of those who have left the workforce across the nation are women. There's a lot to unpack in there, but what I really value about this campaign is that we're sharing stories about many of these intersectional topics: the need for affordable, quality childcare, paid family and medical leave, pay equity, all the data that Al just pointed out, and healthcare. And so if you reference the site, you're going to see not only the quotes and the stories from Vermonters, but you'll see data and solutions, recommended solutions of ways to start problem solving and working towards a better Vermont for everyone. In addition, Al referenced the Vermonters Report Household Impacts of COVID-19. That was an initiative between Amherst College, UMass Amherst, and Indiana University. And as Al shared, we helped gather feedback from over 500 Vermonters, and it's important to note that 89% of those respondents were female. And so built into that long report is a lot of information nationally, but also highlights some of the data for Vermont. And the survey results continue to share the story we knew pre-COVID, and that COVID has just exacerbated. And so it's a packed survey. I'm not going to go through it all today, but the two that I will go through are the following slides that speak to our discussion. The first is highlighting some of the survey results around the impact on childcare and school disruptions. I know there's a lot of text on this slide, so you'll have access to it. But if you sit with some of that data, 79% of respondents with children attributed COVID-19 disruptions in school and childcare to varying levels of job productivity and loss. And 55% of respondents with one or more children in kindergarten reported their productivity extremely affected by COVID-19 childcare disruptions. Obviously, no surprise to this group, but that did surface through the report. In addition, on the following slide, and I know this group today is looking at mental health, so if you could advance that. The survey's results also highlighted mental health and substance abuse statistics, and unfortunately, probably no surprise to look at some of these data points. I'll let you skim through them, but I will highlight just a few. The percentage that reported moderate or severe anxiety and depression, 29%. 41% reported increased use of alcohol since the beginning of the pandemic, and so on. So we're seeing data there that is obviously concerning, remains concerning, and will unfortunately probably continue to be concerning as we try to move forward. On the last slide, if you don't mind, I'll wrap up by sharing that our hope for the commission and with many of our partners, including our partners through Change the Story, is our goal is to continue gathering this data. I know when we had an initial discussion with BBF, data is really important as we build our work and serve our communities and look at our policy decisions. And just the Change the Story data alone, I think, has been used in many different outlets. And so our hope on the commission is to continue to update and expand reports. If we can call together and work better with partners to share data, and I know that's already been a discussion started, and I would offer that today. I think this is a really powerful group of individuals, and we have a lot of data that if we came together, I think we can tell a really, really important story and start to ask new questions. What questions are we asking that we don't have answers to, that we need to start getting answers to, and really are seeking to work collaboratively in that nature. So I would welcome a reach out if anything from today's presentation is of interest to you. And I look forward to our continued work with BBF and partners. I will wrap it up by just sharing, I pulled this out this morning on the bottom into my comment a moment ago about the commission's role in qualitative and quantitative data. we did a listening tour several years ago now where we commissioner traveled all around the state and dove into communities and had conversations. And that data that was organized, and we had a report that was shared in June of 2020, excuse me. And I just wanted to point out as we culled together that data and pulled out some of the most concerning pieces, you can see childcare surfaces at the top. So it just continues to reemphasize for me that childcare continues to be a real concern for us. It's something that the commission tracks and we're happy to be partners on. And I really just commend you all for the work you do and appreciate you taking a few minutes to listen to some of this data about the workforce in the current state.
Thank you, Al. And
I was just going to say, I know I'm supposed to pass it to somebody and I apologize, I'm blanking. So thank you for jumping in.
No problem. Thank you so much. Thank you both. We are so excited to be partnering with you to highlight these important findings and look forward to collaborating on future qualitative and quantitative data collection and dissemination. As Morgan mentioned, this is the third year where the state of Vermont's children has included a spotlight. The intention of these spotlights is to draw attention to important circumstances and issues arising in Vermont, even though we cannot yet tell the full story. Many of the indicators we have presented today and will include in the final spotlight do not tell the why, only the what. And there remain significant gaps in the workforce data that we do have. This table is from last fall, and unfortunately, these questions remain unanswerable, and there are more questions that need to be added. If you have or know of information that might provide a more complete picture, please let us know. As the State of Vermont's Children report is completed, we will include this data and the publications that contributed to it in Vermont's Early Childhood Resource Data and Policy Center, which is now live at vermontkidsdata.org. Before handing it back to Chloe, I would like to thank all of our partners who are providing data, stories, narrative, and expertise to help move forward the goal of evidence and data-informed policies and programs. Chloe?
Thanks, Dora. I know I'm just curious. I'm going off script a little bit. Hope that's okay. I know. I'm just really curious, you know, somebody on the front lines, and I know a lot of us are in terms of even being able to keep childcare open at this point. That presentation certainly gives lots of indications of the structural systems issues we're facing. So it's heartening, and there is opportunity. I appreciate that perspective. And I don't know, I would love to hear from people if anybody has any thoughts on the presentation, or whether anybody else feels like we're at this tipping point, like we are at a crisis. I know there's money coming and plans and bills, and ARPA funding, and all of it just, some days I'm kind of like, I don't know if it's going to be fast enough. So that was a great presentation. It was really, really good to hear, but I don't know. I'd be curious to hear from anybody else. Any thoughts before we wrap up? If anything jumped out at anybody or struck anybody, or you had an aha moment, anything like that, sort of off script, but curious what folks are thinking about in terms of this workforce crisis.
Chloe, I'll jump into your off script. I think it was a great presentation. Thanks all. I think for me, the piece that I have to keep remembering in this conversation is we've come to a crisis point, but it's not all COVID. And I think when we address the conversation, we need to keep in account COVID and its impacts. But we are not in a staffing crisis just because of COVID. And so it was really nice to hear the data pieces that support.
Yeah, that's a great point.
Matthew, I realized that your hand was raised, and I wanted just to be able to.
Yes, finally, I'll be able to now speak. I think we need to look deeper into the formulas of the systems, you know, that we have in place, you know. because the grant formulas, they're all not all transparent that I see, but I see the top three that are very disturbing is jobs and businesses, childcare, and affordability. It's an economic engine. Vermont's an economic engine because the way it works. Without those pieces together, it doesn't work. So what's striking me is we know the formulas, how to come and outside of the box ideas to address these, formulas that we have in place that been, so exacerbated and not kept up to current status that we should look into more of. Thank you.
Mhm. Yeah, that's a really good point. That and it feels like I like the phrase out of the box thinking, like what is the creative transformational thing? So it's like work that we've been doing all along. And it's coming to fruition even, like we've made great strides. It's so exciting. And I just am going back and forth, like what are those transformational things that might really help us?
I jump into, oh, Sonia has your hand up, I think.
Yeah, Sonia and then Allie.
Hi. I just wanted to say that the one statistic that I was like, oh my gosh, was the 28,000 Vermonters that are no longer in the workforce in Vermont. And then I think of the, scarcity literally of staffing that we've got going right now. And I also think of the importance of building our pipeline, using resources, such as, our tech centers and our reach up folks and all the other adult job placement folks. And I know we've been talking about in Lamoille, like, how do we get some funding to work on some of this? It's just, it's incredible. Like you can't build capacity right now because there are no staff. It's so hard to find. And the folks that you are finding often are coming from another program, right? Like, I feel like we're just as is many probably industries, you're in like a cannibalistic mode, and it's not intentional, but it's just, their programs are shutting down or whatever, and so they need somewhere to work. But those are the kind of ideas that I think of particularly that would love, to have us think a little bit about.
Yeah.
How do I?
Exactly. I just, oh boy, it's very exciting to see. I mean, like there's more and more data. This was this very, effective and powerful presentation. I really appreciate you both, Kelly and Al. And I feel the same way, Chloe. It's like, what do you do at this point? Here I am helping to facilitate the movement from Let's Grow Kids side and dropping my kids off every single day to childcare that doesn't know if they can stay open tomorrow. And so like, it's one of these things where we all of a sudden now like know that we've been in a crisis point, and now it's even a little bit worse because of COVID, right? I totally appreciate the comment. It's like COVID has exacerbated it, but it did not create it. And now everyone is realizing that childcare is at the core of so many of these things, and we all need it now. Well, we're talking about moving 250-ish, 206, whatever $million around. Like, it's going to take every single one of us to make sure that that money gets moved around to fix this systemically forever. Like, we've never been closer to a major systemic solution through the path of H171, and it's not enough, and it's not soon enough. You know what I mean? So I would just say, like, I have the same feelings listening to this presentation that I feel every single day now, which is like excited and terrified and frustrated, like all in the same moment. And that's really hard. And I'm not even working every single day, like, the folks in the field who are really, really viscerally like in this like vice right now. So all that is to say, like, we have to keep our heads down a little bit and fix this systemically once and for all. I mean, it's never, ever happened before, as a society. So like, one of those things is like, how do we just continue to do that and understand it's not just like, oh, great, someone's got this under control. No, to make a change like this, it's going to take the entire state of Vermont prioritizing it, all of us in our own ways. But two, what's the lifeline right now? Everything I'm hearing today, everything I'm hearing from the field is a lifeline in addition, beyond this 29 million that went out, that includes a very clear focus on compensation, because it's like the root cause of the root cause of the root cause. So however we can speak with one voice, be as clear as day to folks, keep the calm almost, because like you all know this crisis better than anyone and it's not new, but like keep the calm, the focus, the urgency, and like do these two things at the same time. Data like this helps us, make that point, and BBF is a facilitator that can help us sort of continue to be on the same page. But sorry, I just can't help, just sort of echo from my perspective, not even being in there every day, Chloe, as you are.
Yeah. Well, that's very helpful. Thank you. I mean, I don't mean to not be calm, and we are at this very interesting point, I think. And I saw in the chat, Cynthia put in something, a model from Quebec, Universal Childcare Program. So I think investigating options would be great, and a good comment from Ruth. Yeah, sorry. Sorry to go off script. Maybe I'll get in trouble later. I don't know. But anyway, any other thoughts?
I think this is an incredible conversation, folks, and I don't want to cut it off. We have 8 minutes left. If other folks want to weigh in and talk more about how we use this data, how we talk about this data, where we need to ask additional questions, and how it relates to what's happening right now, right? I think it's a great conversation, and I'm happy to have you go off script, Chloe.
I wouldn't mind just chiming in and talking about this is really cutting across all industries in terms of the workforce shortage and the burnout that exists for the staff. I'm a Family Resource Center PCC and also designated mental health agency. And it's not just in the early childhood world, but it's in all divisions of our mental health agency, from adult developmental services to adult behavioral health. And our early childhood field, we are just seeing staff leaving left and right. Pay is a huge thing. I really appreciate Allie naming that we can offer flexibility, we can offer good benefits, but it really comes down to having enough money to support your basic needs, which was named in these two presentations. And I think the other piece is around housing. There's no affordable housing, not just for our clients, but for our staff. Rents have gone up by hundreds of dollars. I have staff who have to leave because their rents are going up. I have adult staff in their 40s who are moving in with their parents because they can't find affordable rentals, and they can't buy because the housing market is exploding. And so we're seeing people leave the workforce because they're finding jobs that pay higher, that are not related to what they went to school for, or they're just leaving the state completely. And I think that's a huge issue, because if we have people that are leaving the state, we are not going to fill any of these positions. So it's going to be the childcare slots that we can't fill. It's going to be the mental health and family resource center positions, direct service positions going into the homes. And we are seeing high acuity and huge numbers of referrals. We're not going to have those staff to be able to support those kids. And it's like this chicken and an egg, right? You can't have direct service staff going into the home because you don't have them. And then children with big behavioral issues, social emotional barriers, because of the pandemic and other issues, who are then going into short-staffed childcare centers, and those folks aren't able to support those kids because they're short-staffed. So this state, I'm so appreciative of this group of smart people. This state needs to figure out a solution, and quick, because we're in real dire straits right now. Not to, like, in the last 5 minutes be gloom and doom, but this is real. This is real. I've done 90 interviews for our early intervention program, and staff come in and they say, this is a great job, but it's really hard and it doesn't pay enough and I'm going to leave. And so we have been short staffed in that program for the past year, and we get 30 referrals every week and a half, and we have to see those kids because we can't have a waiting list, and we shouldn't. But in many programs we do. So I just wanted to blurt all that out. Appreciate you all listening. And that's where we're at.
Thank you, Amy. Amy Johnson also serves on the State Advisory Council, for those of you who don't know her, and her photo, so that you can put a face with a name, is on our website in terms of Meet the SAC. I think it's incredible and important for this group of leaders to hear all about the workforce crisis across sectors, right? This is not a one-dimensional thing that we're talking about. And you all are this body of leaders in the early childhood arena that are trying to fight to improve the workforce, but we as a state need to come together collectively to tackle these issues. So I'm really proud of the group that's here today to not just present data, but to be hearing it, to be absorbing it, to be thinking about what it means for your sector, and then how do we move forward? What's the next step? So as we're moving into this next iteration of the State of Vermont's Young Children, we will be highlighting workforce data across sectors. And if you have data that you'd like to be highlighted, there's a very tight timeline for it to be included in this year's report, but we will do whatever we can to get it there. And if it can't be there, we'll highlight it on vermontkidsdata.org to make sure that we really are capturing a holistic picture of the current status, not just of kids and families, but the system of services that supports them and how we think about strengthening that system, whether it's from a workforce perspective or ensuring that kids have access to the services that they need. We are down to the last 3 minutes, so I do want to transition it back to Chloe to wrap us up, but I really appreciate the discussion today.
Yeah, and thank you all for being here and for taking a little time to ponder that. I think and the data focus is great. And I just echo Morgan, what you said. Let's keep thinking about that and how to crosswalk data and make it really compelling. I think there's a lot of data, sort of like, I love change the story. It's how do we use it to actually get people to change their minds? So thank you all. Thanks for all the work you're doing. I hope you're all taking good care of yourselves as well as we transition to late fall and winter. But you know, it can be challenging to do this work, and it's a lot easier to do it with, as I forget who said it, Amy, I think, smart people like you. So thank you very much for being here. Take good care, and we'll see you next time.